Thank you, and it gives me great pleasure to introduce Dr. Cynthia McCurren, the Association, Board Chair of the Association, American Association of the Colleges of Nurses. And Dr. McCurren, your testimony, we'd love to hear it, and you're recognized for 5 minutes.
Thank you, Chairwoman DeLauro, Ranking Member Cole, and members of the subcommittee for this opportunity to provide testimony on behalf of the American Association of Colleges of Nursing, or AACN. I am Dr. Cynthia McCurren, and I'm chair of AACN's Board of Directors, and I'm also Dean and Professor at the University of Michigan Flint School of Nursing. On behalf of more than 850 AACN member schools, which educate more than 565,000 students and employ more than 52,000 faculty across the country, I would like to personally thank you for your leadership and continued support of nursing education, our workforce, and research, especially during these unprecedented times. As we work to combat current public health challenges and prepare for the future, AACN, along with 58 members of our Nursing Community Coalition, request at least $530 million for the Title VIII Nursing Workforce Development Programs and at least $210 million for the National Institute of Nursing Research, or NINR, in the fiscal year 2023. From the classroom to the front line, we have all witnessed how critical a well-educated nursing workforce is to providing high-quality health care. While AACN saw student enrollment in entry-level baccalaureate nursing programs increase by 3.3% in 2021, we also saw enrollment decline in our baccalaureate degree completion programs and our graduate programs at the master's and PhD levels. As we look to the future and the need for increased enrollments to support the healthcare demands of the nation, it is important to recognize that more than 91,000 qualified applications, not unique applicants, were not accepted at schools of nursing nationwide in 2021 alone. This is in part due to insufficient clinical placement sites, inadequate numbers of faculty and preceptors, and classroom space, as well as budget cuts. That is why federal funding for nursing education and our Title VIII programs is so important. We must support our nursing schools, faculty, and students. As a leader in nursing education, I have witnessed firsthand the benefits Title VIII funding provides. From supporting graduate education for nurses who work and live in rural and underserved areas, to training for sexual assault nurse examiners critical in our urban and rural areas, and promoting diversity within the profession by providing grants to students from disadvantaged backgrounds. Title VIII nursing workforce development programs have been and will continue to be a short and long-term success story and must be provided with funding levels that reflect the population they serve. As we prepare the next generation of nurses and the faculty who educate them, we must also support the evidence that guides their practice. As one of the 27 institutes and centers at the National Institutes of Health, the National Institute for Nursing Research, or NINR, funds nurse scientists who work collaboratively with other health professionals to generate and translate new findings and lead translational research that helps address health equity and the social determinants of health. Bold investments in Title VIII nursing workforce development programs and NINR are imperative, not only as we confront existing health challenges, but as we provide tomorrow's equitable and innovative healthcare solutions. Therefore, AACN respectfully requests support in fiscal year 2023 of at least $530 million for the Title VIII nursing workforce development programs and at least $210 million for the National Institute of Nursing Research. Together, we believe we can ensure that such investments will promote and improve healthcare in America. Thank you so much.
Thank you so much. My own experience with the nursing profession was some 30 years ago, and diagnosed with ovarian cancer and spent a fair amount of time in the hospital. And while I can applaud the surgeons and their great work helping to save my life, it was the nurses who came every day and who just by one look at me could tell whether, it was a good day or a bad day, and they were always there. So we know the nature of the profession. We also are very conscious well, my view, and I'll just be frank about it, I don't think the Institute of Nursing Research gets enough funding as I believe it should, and we'll take a very, very hard look at that. I also know that there's a very big high debt, student debt for folks going through the nursing program. So loan repayment is another critically important effort. And you have so many nurses who are ready to retire that looking at the profession, what we need to do is seriously think about how we are really going to strengthen nursing, and because we know the role that they play, but the critical role that they played during the pandemic. So you can be sure we're going to take a hard look at this. Congressman Cole.
Thank you, Madam Chair. As in this and so many other areas, we certainly don't disagree. I know in my own state, a number of years ago, under former Governor Fallon, we did a survey of critical needs in our workforce. This is pre-COVID. Number one was skilled nursing, literally. And, having dealt with, and as we all have, all my providers during this really critical time, I know how we stretched the nursing workforce and how difficult it's been for hospitals to get to what they need, and how tough it's been on people in the profession who worked really, really hard. And frankly, how intense now the competition is, not just within states, but across state borders, to try and get that workforce, all of which just reinforces the requests that you've made. And so just thank you and your profession for what you do selflessly. And again, these are needed skills. They're not going to go away, and these are important investments. And again, as the chair always points out, we don't know what our money is now, but I can't imagine you won't rank high on the areas that we all agree on the committee we need to focus on. So thank you for your testimony. Yield back, Madam Chair.
Thank you. Congressman Fleischman.
Thank you again, Madam Chair and Ranking Member Cole, for your comments. I would like to say this. In my great state of Tennessee, we have several great colleges of nursing, and I have spoken with these students. It takes a special person to be a nurse, but there is boundless optimism with the students that we are producing in our state. So thank you for what you're doing, so critically needed and very important. So I wish you continued success. And again, this is one of the areas of broad agreement on this subcommittee. So thank you very much.
Thank you all.
Thank you very much.